for adults. So she does have a slide presentation that we'll be going through. There is not a need to go into the speaker view. You should be able to see the slides large on your screen and then Dr. Ilodi off to the side there. If you have any questions throughout the presentation, go ahead and type those into either the Q&A or the chat, and we will address those as we can. So welcome, Dr. Ilodi, and I will turn it over to you.
All right. Good morning, everyone. How are you today? And I hope you are well. I am, again, Yulita Ilodi. I'm the medical director, and just happy to be here to discuss empowering older adults. I think that this is a very important topic, especially as we approach, as we're in our new year, and how we can have a stronger voice. So just a couple of discussion points. Again, I want this topic to be a little bit more informal. And so I am perfectly fine if you have a question, type it in the chat, and we could even stop and discuss that. I always have a couple slides just to facilitate the discussion, and I want this to be something that you guys are able to participate in. So some discussion points. We're going to talk about the 65 and over population. What is health empowerment, and what are the tools that we need? So I put this in here because I think that this slide is absolutely amazing. So we had the census, of course, last year, but before that it was 2010. And you will probably see in many places where they say that the 65 and over population will double. And so as you see, as it approaches to 2050, it's supposed to be somewhere around 22 million. Next slide. The question for us, right, is how people are living longer. People are staying healthier longer. And how is this happening? How are people having a better quality of life? So you're right, that is a great thing, is that people are living longer, but they still are suffering from diseases where they have to still go to the doctor. And I thought this slide was a great slide because it highlights those facts, that 80% have at least, of individuals over the age of 65, have at least one chronic condition that they'll be hopefully seeing a physician for, or a nurse practitioner, or whoever, whatever provider, that you may want to see. And 68% have 2 or more chronic conditions. And I like to start off with high blood pressure. And I want to start off too with some of the myths about these. The myth is that when you get older, you will automatically have hypertension. That is not the case. It's not an automatic. And 58% of individuals over the age of 65 will have it. High cholesterol, 47%. Arthritis, I think this number is just a little bit off, truthfully, but it says 31%. We call this ischemic heart disease, also known as maybe people who've had a heart attack, maybe people who've needed a stent outside of a heart attack, and it was caught early. That's 29%. Diabetes, 27%. Kidney disease, again, I think one of these numbers are a little bit off, 18%. Heart failure, 14%. Depression, 14%. Alzheimer's and dementia, 11%. And COPD, 11%. Next slide. And so I like this article, and I know it comes out of Hong Kong, but this is one of the better articles that I found that discusses health empowerment. And so I threw that out there because just in case you guys are readers like I am when it comes to medical journals, if you wanted to read this article, it was a good one. So it is a process by which people can gain greater control over the decisions affecting their lives and health through education and motivations, can be an effective way to enhance health-related quality of life, health awareness, and health-seeking behaviors. That whole sentence, run-on sentence, is just full of very strong words that I felt really highlighted what the definition is of empowering healthcare. So I actually put it better this way. So the goal is to gain greater control over the decisions as it relates to your health. We do that by being motivated. And we could do this in any order. So I didn't have any order. We could do this by being motivated, by educating ourselves, by having health-related quality of life, by having health awareness, health-seeking behaviors, and enhancing health. And the reason why I say that we could put this in any order is because our journeys are all different, right? So I could go to a health fair and have health awareness that they took my blood pressure, and my blood pressure was 160/90. And that might lead to me seeking better health care, having better behavior. And that might lead to motivation. And so as you can see, it can go in any order. And it's not so much the order, but these are the things that will contribute to us gaining better control. Next slide. So what do we need to do first and foremost? I cannot say this enough, and I know, and I just say for my patients, some of my patients have so many doctors, and God bless them, but to follow up with your primary care provider or your nurse practitioner or whoever you may see. I'm not married to any one of these. Yes, I'm a physician, but whoever is taking care of your health, that's who you need to follow up with. Health literacy, technology accessibility, and self-care. So you follow up with your physician and you're 65. What should they be doing? Well, if you're otherwise healthy, no medications, no illnesses, no chronic disease states, they should be doing screenings. What are screenings? Well, screenings is exactly what it sounds. They're going to screen you for diseases. Preventatives, they're going to prevent you from having diseases. Diagnostic, that's when you have a symptomatic care or investigative. That means something is wrong with me and I need you to investigate what is going on. And then lastly, which is also the most expensive, crisis care. That means something happened, maybe it happened suddenly, maybe over time, and now we're into crisis care and going to the hospital to get treated. So screening, so these are your basic annual follow-ups. They're screening you is the moment you walk through the door. They're looking at your blood pressure. They're looking at, and when they're looking at your blood pressure, you should always ask them, what is my blood pressure? They're looking at your, what I call hyperlipidemia, which is your cholesterol. You should be getting your cholesterol checked at least every 5 years, at least, but most of us should be getting it checked yearly. Between the ages of 40 and 75 years old, plus being overweight or more, you should have something being checked for diabetes. It's called your A1C. Everybody over the age of 65 should be checked for osteoporosis, and those are like what we call bone density examinations, and we do that via something called a DEXA scan. This is a AAA. Maybe some folks have not heard of it, but it is a screening that often gets missed. And if you're a man with 100 cigarettes you've ever smoked 100 cigarettes, you should be screened for what we call an aneurysm. Couple cancer screenings include breast cancer, lung cancer, and colonoscopy. And again, these are just screenings. These are literally just to check for the disease state. This doesn't presume that you have it. So immunizations, this is more of your preventive care. So everybody knows you get your annual flu. You get the tetanus every 10 years. So the zoster vaccine is for those who are 50 years or older, and that's going to protect against shingles. I can't say this enough that even if you've had shingles, you should still get this vaccination. Pneumococcal vaccine is going to be for ages 19 to 64 with risk factors, any risk factor almost, and over the age of 65, as well as the hepatitis B. There were a couple that I did not put in there because I was doing 65 and older, but a couple other ones that they may screen you for is hepatitis C, as well as HIV if you're younger than the age of 65 or you have risk factors. So I wanted to throw that in because I sometimes will test for those. So diagnostic care, again, is medical care that involves treating or diagnosing a problem or something that you need to monitor and check on. So that typically means, and I gave some examples down here, if you have some polyps or rectal bleeding, you need to get that checked. That's diagnostic. They're trying to figure out what's wrong with you. If you have a breast lump, getting a mammogram, and again, that's diagnostic because they're trying to figure out what's going on. So that's why we call it diagnostic care. You're at home, maybe you have symptoms, something's wrong, and then you go to the doctor and they follow up and figure out what's going on with you. So your appointment. So this is what's going to be very empowering. And I've learned some of my best tricks from my patients that actually come in. So at your appointment, prior to you prepping for it, create a list of questions prior to the appointment. If you're anything like me, you get in that appointment, you get to talking, and it's gone. And if you guys know, I feel like it's easy to contact me, but my patients say otherwise. So it's always great to have those list of questions. Bring a notepad. If you feel like there's just so much being thrown at you at one time, and as a physician, I am also guilty of that. Don't mean to do it. I just want to teach you so much about your health. I get so excited. So bring a notepad. Tell the doctor to slow down. Tell them to slow down. Repeat instructions. Have them do a teach back. You can say, so let me clarify what you're saying is, and then clarify their instructions. I've had some of my best patients do this, and I'm like, I'm going too fast, and I'm so sorry. And write down the instructions. Don't count on us to write them down in the way that you'll understand it. We will write it down in a way that makes sense and that we think you could understand it. All things are not equal. And understand how long your appointment is and triage your problems. So yes, you've been waiting in a waiting room for 10 minutes, and then you've been called back and you're waiting maybe in a room for another 5 or 10 minutes. Doesn't mean that now you get an hour with the doctor. That your appointment still may only be 15 or 30 minutes long. So you want to be able to triage what is really important for you to discuss in that appointment. Next slide. So during appointment, inform your physician what is important to you. Now, if I come in there and I'm like, ouch, my elbow hurts, and he's worried about getting x-rays and worrying about exactly what it is, but I'm still in pain when he leaves, that's nice, but I'm gonna let him know, hey, I still need to play tennis. I need you to make my elbow feel better. Give me some type of expectation when it's gonna feel better. So again, discuss expectations. What am I to expect here? When am I gonna expect a phone call? What am I to expect with this treatment plan? Discuss different treatment options. Oh, you know, that medication, I don't know if I want to be on that medication. Is it a different treatment option? Is there something else I could take besides a pill? Is there a salve that I can use or an ointment I can use? Ask if the diagnostic test can be done now or revisit later. You've already been sitting in the doctor's office for about an hour and a half and you're starving. Do I have to get the blood work now? Or can I get it later? How long will it take? Is there anything I can do to improve my condition? So important. But when I say that line, a lot of people get the answer they don't want, which most of the time includes healthy diet, healthier diet. I know a lot of us try to be healthy, but healthier diet and exercise. Any side effects to the medication, super important. Again, as a physician, you try to highlight the big side effects, but if there's something in particular that you fear, you definitely want to speak up. So like if you fear dizziness and you're like, is this going to cause me to be dizzy? Please be very upfront and ask. And then lastly, on this slide, how will I hear about my test results? I have a saying, if I take blood from you, if I take anything from you, you need to know what's going on. You took my blood, they took my blood, I need to tell them what's going on. And that's the way things work. But that's not always the case. And some doctors can at least tell you no news is good news, right? Which is, it's something, it's better than nothing. But I think I deeply believe that in the day of age of being able to see your results, that you should be hearing something from your physician. And so you should ask, how will I hear about these test results? So other questions, it's okay to ask about costs. I may not know the answer to that as a physician because, you know, I would do this for $1, but, you know, insurance companies are all different. Everybody has different insurance premiums and et cetera. So, but it's okay because we may know. We may know how much the medication, or at least ballpark it. It's okay to get a second opinion. If I diagnose somebody with cognitive impairment and they don't believe me, I'm happy to give them a second. I send them for a second opinion to somebody who's not in the same hospital. And most importantly, it's okay to ask why. If you don't understand something, ask why. I can't tell you how many times that as a physician has stopped me right in my tracks. And it even slows down the pace because at this point then I'm sitting down and I'm making sure that before they leave that they understand that their health and what's going on. Technology is super important these days. Use your technology. If you don't know how to use it, ask someone. So my chart is something that we use, very, very easy to use. You go in it, you can see your blood work. And in most places, by April at least, you're going to be able to even see the notes that the doctor wrote. So they won't be able, as physicians, we won't be able to opt out of that at this point. But you'll see the notes. You'll see your labs, you'll see any type of x-rays you may have had. Get applications or apps, you know, those apps on your phone. It's nice because, like, for example, if you suffer from headaches, they have a journal app where you can kind of just put the time in when you're having this headache. And it keeps track, or they have diet diaries. If you're having diarrhea, they have stool diaries. They have all kind of apps. You don't have to just sit and use good old fashioned pen and paper. Set alarms for your medications and reminders, and set calendar notices for refills. So I wanted to go through a couple cases, and I just wanted to walk through this case just so to highlight just some examples. And as a physician, we kind of learn about these ways. So I'll just go ahead and start reading. And if you guys want to put some answers down in the chat, that would be great. So a 70-year-old female with a history of high blood pressure and cholesterol goes to see her doctor of 20 years for a routine visit. She waits patiently until the doctor comes in. He starts her on a blood pressure medication for high blood pressure. He smiles warmly and says he will see her back in 6 months. What's missing and what should she ask? And I'm just going to kind of give it a couple seconds here because I want you guys to kind of think about this. Yes, side effects, absolutely. So she might should ask, what is my blood pressure? You know, you say my blood pressure is high. What is my blood pressure? I love that. Monitor blood pressure at home, right? Can I monitor it at home? So that goes back to a different type of treatment plan as well. Like, exactly. Is this the only treatment option? I love that. Can I take it at home? Can I decrease my salt intake? You're having a conversation. I call it, just like people have financial advisor, I'm like your health advisor. We should be discussing this together and partnering on your health. So those are all great answers. And I love them all because, again, I've had patients who just come up like, Dr. Ilodi, I really don't want to be on any more medications. Can I do this and this? Also, how about asking me if I even took my medications today, right? There's some people are under this presumption that when they go to the doctor, they shouldn't take their medication. I don't know why, but it really, really does happen at least once or twice a day for me when I'm seeing patients. And so I'll say, did you take your medications? And they say, well, no, Dr. Ilodi, I thought you want to see my blood pressure without it. I said, no, I never want to see your blood pressure like that again when it's almost 200. So again, I will ask them, did you take your medications today? Because maybe they just didn't. So, and that's important because then if you start another one, then you're really making your blood pressure low. Next slide. And I have 3 like this, by the way. So whoever doesn't get a chance to answer can answer some of these. 73-year-old man goes to his doctor because of recent pain in his left knee. He is in good physical health, but had a recent fall while walking. This is the type of guy who's going to walk, rain, sleet, hail, snow, doesn't matter. He is doing well otherwise. The doctor orders an X-ray along with other tests. What should you ask him? So you're say this is maybe your spouse or your significant other or your brother or a friend, and you're saying, you know, you should have asked them this. And if your doctor doesn't ask, you can always offer. I would say, what were you, yeah, you were walking, but did you just pass out? That's important. A passing out is a whole lot different than falling and slipping on snow. We can't assume. Right, what injury will an X-ray reveal? Yes. Why are you getting this X-ray? How will this change your management?
Jody, you're unmuted if you want to ask your question. Sorry, she raised her hand here.
So, you know, there's a lot to unpack in this little case here. But what about my pain, right? How are you going to treat my pain? Again, I was talking about the elbow. I really just want to go back to playing tennis, right? And he's getting an X-ray. It's like, whoa, what are you going to do about my pain? How are you going to help me get back to my normal activities? And that's okay to ask just like that. Okay, next slide. And this is the last case. After your appointment, you take home an after visit summary. I don't know if you guys know what that is, but that's like that thick stack of papers they give you afterwards. And they expect you to read through every single line of it. My mom does. But I'm always thinking to myself, who really reads that? But if you do, great. I think that's wonderful. It lists all the medications that you no longer take. What should you do? So I don't know if you guys know, in that packet, they have a list of your medications, and you're going through those medications and you're thinking to yourself, I'm not on that one anymore. I'm not on the azithromycin, the Z-Pack. I don't take that anymore. And they list all of these medications. And my question to you is, should you just ignore it?
Get them off.
That's right. Ask for those old medications to be removed. Fantastic. And a great way to do this where you're not wasting your time is to use your technology. So you can go to My Chart or whatever type of patient chart that you can log into and just simply type, please remove these. Because if anything at worst were to happen with these universal electronic medical records, and that is on your chart, you may end up back on it if you're ever in a hospital. And we've seen this way too much where we're like, after they come out of whatever condition, they're like, I haven't taken that for like 6 months. Or my doctor stopped that 2 months ago. But again, it continued to be on their list. And so when they got admitted, it was just shifted forward. So really scary stuff, right? Something like a Z-Pack, okay, not going to kill you. But if you're on Lasix or if you're on a blood thinner and they put you back on there when you're not supposed to be, it can be very dangerous. So I always say, make sure that your medication list looks appropriate. So, and this is the second part, staying healthy. This is the part you guys really don't want to hear. I should speak for myself. So 150 minutes of exercise per week. So exactly. So what about the health issues that are in the past? As far as those being on your after visit summary, I definitely agree with you. I teach resident physicians, and yes, you definitely want to clean up what we call a problem list. We call that the problem list. And if something is unresolved, you need to get it off of that problem list, as well as making sure they're in the appointment, making sure they're actually resolved as a physician. And if your doctor doesn't bring it up, you bring it up, and that's okay. Again, being mindful that maybe the appointment's only 30 minutes. So you want to be mindful and again, use your technology. So 150 minutes of exercise per week. You can break that up however you want. And just because you maybe get 100 minutes doesn't mean you're unhealthy, but that's just a goal. It could be walking. It can be a combination of walking with passive resistance exercise or active resistance exercises, whatever you can do. And that's important because, you know, I know some folks who run marathons. I can't run a marathon, and that's not what I'm going to be doing for my exercise. So whatever you can do is what you do. A healthy diet, reading about what's healthy. We all pretty much know what we should eat and what we should not eat. So again, bringing that back to limiting your lifestyle, the things that affect your lifestyle, such as smoking, drinking, etc. Limit trans and saturated fats. It's really hard in this day of COVID with more and more people eating out and eating at fast food restaurants, picking up things, but you want to limit fried foods. Avoid unnecessary medications. Now, this is really me putting my geriatric hat on. So I can't tell you enough that if you're over the age of 65, you want to avoid sleeping aids, like anything with Benadryl in it. And you want to avoid something called benzodiazepines. That's going to be like your Xanax, your Ativan, etc. So it's only 2/3 of people on the benzodiazepines will fall. It's just a matter of time. Benadryl makes you very sleepy and it could stay in your system for a long time. and certain sleeping age, except for like melatonin, can also inhibit you and cause falls. And again, that to me is a bad word at a certain age, is the falls related injuries. Avoid excessive alcohol. I had one lady, bless her heart, but she just noticed she was drinking more during COVID because she was like, I think I'm just bored. And before she knew it, she was going through half a bottle of wine. And I can only imagine, I have my 3 kids to keep me busy, but I mean, again, because I'm not judging, I'm like, I kind of get it, but it's not good for you. If alcohol was like carrot juice, we would be all good, but we just want to limit that to 1 to 2. Throw rugs, get rid of them. I am the throw rug queen, where I will come in your home and remove them. And know when to stop driving. That's a big one. I see so many car accidents because I'm up at Suma Health System, and that's for some reason right next to the University of Akron. So now you got like young adults mixed with like an older adult population. It's just not pretty. And so know when to stop driving, when those reflexes begin to go, because your as somebody who's an older adult, you clearly drive better than a 19-year-old. However, your reflexes may not be at the same capacity. So whereas that 19-year-old can stop at a dime, there may be some time for you to do that. Or if you don't have the mobility in your neck to be able to turn, and this is really at all ages, but we see it a little bit more in older adults. If you're having problems with arthritis, especially like I said, that cervical arthritis, if you're having vision impairment, I really just say for you to restrict your driving before something bad happens, because the last thing anybody wants is for like their driving privileges to be taken away, or to be harmed, or to harm someone else. And that is it. Anybody have any questions?
Thank you so much, Dr. Ilodi. If you have questions, you can go ahead and type them into the Q&A or chat at the bottom. It's such an important topic to talk about empowering, especially the elderly, but really everyone when it comes to discussing medical matters with your physician. And so many times people are so quick to just take whatever the doctor says and not question. If he wanted me to have therapy, he would have ordered it. Well, sometimes you have to put the bug in the ear and advocate. So to really reinforce the need to advocate is so huge.
Absolutely. And I tell you, thank you so much, Marla, for that, because that's so important. I mean, just think about it. Think about, bring to Dr. Ilodi to mind, right? So think about how I'm like, I got like 3 kids and they're running around like squirrels, and I'm dropping them off all at school, and I'm doing this all before my appointment with you. And so if I'm sitting there with you, right, and I don't bring it up, this is not because I didn't want to. And so feel empowered to ask. And I always tell my patients, blame it on my brain and not my heart. You can blame it on my brain too if you want to. But, we too have things that are going on, and maybe we are seeing 30 patients that day because that's what we're told that we have to do as well. And so it's okay. And your doctor will actually thank you emphatically for telling them what's going on and having that conversation.
So important. What about when is the time to seek out a geriatrician? You have your PCP, but you want to see someone that really specializes in the elderly, or to overlook your systems a little deeper. When is it time to search out a geriatrician?
So I would say, all geriatricians are not created equal. So some folks that you find on the internet that say that they're a geriatrician, it just means that they see a geriatric population. It doesn't mean that that's what they're double boarded in. And so I would say be careful with that, because you may be disappointed. Now, if you start to have falls, or imbalance, just being unbalanced. If you're noticing there's any type of cognitive impairment, any problems with mood disorders, I call it the worried well. Like you're just noticing you're worrying a little bit too much and you don't really want to go see a psychologist. You don't really want to see a psychiatrist. You don't feel like you're there, then that's a good time you want to start seeing a geriatrician. Because actually those conditions are unique for the older adult population and they're not uncommon.
Not seeing any questions coming through. Give everyone another couple minutes. If you have a question, you can go ahead and type it in to the chat box there. And I also appreciate what you mentioned about second opinions, that it is okay to ask for a second opinion and one outside of your physician's practice.
Absolutely.
It doesn't mean that your physician's wrong. It's either going to possibly contradict maybe what they've said, but maybe reinforce and give you that confidence to move forward. So,
and it's always nice to get that, to tell your doctor, and this is why, because if you tell your doctor, if somebody's telling me, I want a second opinion, I'm like, okay, I can help facilitate that. So whether it's them, they want to pick the person, or they want me to help them with that, which I can. I'm going to make sure the CAT scan, the MRI, the blood work that you've already had done gets to them as quickly as possible so that they're not recreating the wheel and putting you through those tests all over again.
Not seeing any other questions come through, but we appreciate all of your information today. It's very useful, and I know you're coming back next month. Can you tell us what your topic will be next month as well?
So I was going to do another COVID update next month, but I would like to do driving. So you get these COVID updates, and I'm like, oh, because the strain is there's the Pfizer vaccination is good for 16 strains of the COVID SARS-CoV-2, but I'm going to probably do driving.
Okay.
Yeah. Sorry. I love talking about COVID because it's so much out there.
We appreciate it. Well, thank you.
Talk about whatever they want me to talk about. Like, it's just whatever you guys feel like you need the topic to be. I'm happy to do that.
Certainly reach out. You can reach out to myself or to Sue or to your care coordinators as you have ideas, and let us know, and we will pass those along to Dr. Ilodi, and she will present that information to us. So
absolutely.
Thank you for being here today, and everyone enjoy your Friday, and go Browns.
Go Browns. I think I have my show. Yes.
Yeah, there you go.
There we go. All right. Well, thank you, everyone. Again, you can contact me through Mara or whatever you guys wanted to, whatever discussion you want to have.
Thank you so much.
All right. Thank you. Bye-bye.